Yeah, so Health Colorado didn't only partner with Wisdo because of the strong data, the proven results, and the evidence, but we really genuinely saw an opportunity to support our own core pillars, which is members first, equity for all, culture of access, and keeping ourselves performance driven. By partnering with them, we did keep our members' needs first. We really did reduce barriers while also improving access to care. So how did we do it? Our implementation. We used a collaborative and blended approach. So that means that we distributed information both to our providers and our Medicaid members simultaneously at the same time. We wanted to get all of the resources and information out there to everyone. We used a department-wide engagement approach. So we invited our department directors to come in to speak with Wisdo. Wisdo shared information about their mission, resources, they offered training, they offered support. They were available every time we needed them to help answer questions. We used targeted messaging campaigns. With our providers, we said, hey, we have this amazing free platform. If you know any patients that are suffering from loneliness, please share this information with them. For the Medicaid members, we said, hey, if you or anyone you know is actually dealing with problems of loneliness, please feel free to use this great resource, this free platform. Our strategy was to provide training, support, and integrate Wisdo into Health Colorado's current existing systems. And for us to do that, we assigned roles and responsibilities to our directors from every department to help ensure a smooth transition. So let's hone in a little bit on communications, because communication is key. Without proper communications, we wouldn't have had the right results and we would have not been effective or efficient. So what we did is we had to identify our audience. We performed an audience analysis to really understand who do we need to communicate to. And by doing the audience analysis, we identified the Health Colorado staff, obviously, as our internal key stakeholders, and externally, it was our healthcare providers, our care coordinators, and our Medicaid members. Once we understood the correct audience, then we were able to bring it together to build that communications plan. In doing so, we took a mixed media approach because we really wanted to reach the vast audiences by different means of communications through different types of channels. So as I mentioned before, we held regular meetings with Wisdo. Anytime we needed help or assistance, they were readily available through email communications. They were jumping on calls. They were working with our directors for anything that they needed. We also had our provider newsletter. So we actually took the Wisdo link and inserted it into the newsletter, distributed it out to the providers, and said, hey, click on this link. You can learn more about Wisdo, or if you want to meet Wisdo yourselves, you can do so. We provided that contact information to them directly. And then Wisdo graciously developed slide decks, email content, social media content, and printed materials for us to use. So it was a really easy lift for Health Colorado. All we had to do was actually take that message that they gave us, which was tailored to those audiences, and distribute it to the different communication channels that we had. So we really wanted to design a timeline that was going to be both ambitious and achievable. So to do that, we decided that we would create a plan that would be rolled out in a few months. We began our initiative in January, and that's when we collaborated with the departments. We invited Wisdo to come in and meet with them on individual basis, also on group basis as well, to provide that support and answer any questions that they had. By March, we conducted a soft launch. We primed our audiences. We informed them that we were going to have Wisdo, this platform, coming out soon. That way they had an idea of what to expect in the coming months. Finally, by the 1st of May, our official launch day was on the Mental Health Awareness Month, because we really felt like loneliness fell under the umbrella of mental health. And I do want to throw Mona Allen out there as the reason for that, our Senior Director of Crisis Communication, because we genuinely did come together as a team to identify when would be the best time to roll this out to everyone. And now I'm going to hand it over to Matthew to speak a little bit more on care coordination.
Thank you. Good morning, everyone. As Sarah stated, WSDO was rolled out to care coordinators in May of 2024. So, care coordinators in this situation with WSDO, using it as a tool, they were acting kind of, as the primary actors. They're taking the tool, speaking directly with members, identifying if loneliness is potentially a gap in care for that member, and if so, using this WSDO tool to supplement that gap. A little bit about the training that we provided care coordinators. So, the essentials: how to access window, how to access WSDO, how to assist a member in accessing WSDO, as well as some basic scripting for care coordinators to communicate to members, and then also, the ability to help a member in building their profile, which some of the questions that we initially got from care coordinators around use of an application was members' ability to kind of use technology. Care coordinators saw that as a potential gap, and as we rolled this out, we realized that WSDO is actually very simple, that it can be for anybody 18 and above. As Ron alluded to, we have older members, younger members, with the average age being 37, and so we really wanted to provide that baseline level of education to our care coordinators about how WSDO is used and how members can, become engaged in the community and ultimately reduce their loneliness. Couple things that we did just structurally. So Sarah talked a little bit about implementing WSDO into our system. So for care coordination, we use a tool called a set. And once we were educated on WSDO, we added WSDO as a resource referral into our ASET documentation system, as well as our general care coordination intake. Include social determinants of health questions, identifying if members are connected to family, friends in the community, and if not, we really want to make sure that we're referring members to WSDO and engaging them there. These are just reported benefits. So in speaking with care coordinators, these are things that in working with members, they felt like were the biggest benefits. WSDO being available 24/7. So that's a complaint that we hear from our members sometimes is, I'm only able to speak out and reach somebody, have a conversation when I'm feeling lonely during normal business hours. And that's not necessarily when people are really struggling and need to talk to somebody. That members feel safe and that there's no identifiable information and that they can remain anonymous. Ron spoke a little bit about that, and members have communicated with care coordinators that they really enjoy, being able to remain anonymous on the application. It's different than, normal kind of Facebook, Twitter, Instagram, where it's very much a like-oriented application. WSDO doesn't have that. It's not doesn't create that sort of competition. No trolling, harassing, or bullying on the platform, which you see in other social media apps. And members don't have to deal with any advertising, which is great. It's just the ability to connect. And then WSDO monitors the platform for any suicidal ideation, self-harm, or harm to others. So you have that kind of fail-safe there. Here's some quotes from members who have used WSDO. No matter what time of the day, if you're having an episode, there's always someone to reach out to. It's probably the happiest I've been in a long time because I got a lot of emotions out and a lot of good feedback and ways to deal with it and things that are working for them that they've already been through. And I think the member's really talking about peers, right? Being able to connect with peers, and they've been through these types of situations and can provide insight. There's something in there for everyone, whether it's anxiety, whether it's depression and anxiety, or whatever it is, that you can get on there and talk to somebody and you'll feel better. It's an unbelievable app. It's something that unless you look at it and go through it, you don't understand. It's quick, it's efficient, it's spot on. I couldn't do anything. I just wanted to sleep. Now I'm back up in the mornings feeling like I'm alive. They made it a safe place where you go and they'll help you. So a lot of positive feedback we've received from members through care coordination. And also here's some things that, as we were rolling it out, we wanted to make sure that this was successful. We wanted to make sure that members knew how to connect, that care coordinators knew how to utilize it. And so these were some of the things that we did to kind of increase success. So with Health Colorado, we have 5 care coordination entities, and so we reached out to those entities to try and get some WSDO-specific materials in their lobbies, in their waiting rooms, just out to care coordinators in general. So if they're in PCP offices or just meeting with members face-to-face, they can share those materials with them and get some engagement there. We educated healthcare providers, nurses, social workers, and care coordinators on WSDO and its benefits. As Sarah kind of alluded to, using different communication channels. In this example, specifically text messages to connect Medicaid members with WSDO and provide education about the app. Targeted ads were launched across Health Colorado social media platforms that included Facebook, Twitter, LinkedIn, and Instagram, just to raise awareness, let our members know that WSDO is out there and available to them. We also offered small incentives for Medicaid members who sign up and then engage and then provide feedback, whether positive or negative. We also track data and metrics to identify performance, such as the number of app downloads and active RAE4 users. And then as well, we have the Member Experience Advisory Council, where members are becoming WSDO ambassadors, and they're leveraging these peer support programs. And it also helps to foster a sense of community within WSDO, and looking at that from the member perspective. And I also have a video that I'd love to share here with you from a member who's been utilizing WSDO.
I was stuck in my head is the best way I could say it. I didn't want to do anything. I didn't want to get up. I didn't want to talk to anybody. I wouldn't answer my phone, just because I couldn't handle it. It was too much for me. And so reaching out on there and finding out that, there's certain ways that people have good ideas to overcome that, now I'm going back to the stores just because someone encouraged me to try it. It's been a while. Give it a try, and then let's discuss it when you get back. They're there to lift you up and not, just keep you hanging on. So they were able to they gave me a hand up and not a hand out, which was nice. I think it's a judge-free zone, that nobody's judging you. It doesn't matter what your issue is. Everybody has a different issue, and they're all about trying to get you better to a better space to where you can be happy again and love people and maybe go out in public, and not be so isolated from everybody. So discovering WSDO was, really great for me. It's probably the best I felt in a long time. There's people checking on you. There's people writing stuff that really, truly care. People are going through similar things you are. Once I started using that app, even though it's been a short time, I feel 80% better than I did coming into it. I think it's for everybody. I think that you need to spend, 20 minutes just in there, just getting to know and put in your stuff, and you'll be surprised at how many other people are struggling just like you. You're not alone. We all feel so alone, especially since COVID. So I tell everybody, you got to give it a try. It's the best app that you will use that will change your life.